West Coast, Director and Director of National Major Gifts for Shaare, Zedek, and Jennifer Weinstein, our real director. So we thank them for their coordination and efforts. You're not here to hear me, you're here to hear Dr. Gershov-West and the rest of the panel. I will introduce them following the presentation. But without further ado, Dr. Gershov-West heads up the emergency room at Shaare, Zedek, a very busy place if anyone has ever been there. I wonder how many of you have been there? Well, we know why you've been there, right? She took care of you, and we understand. But fundamentally, it's an amazing institution. You kind of get a little lost walking in. You wonder where you're going, sort of underground, until you walk into this very beautiful facility, very well equipped, state of the art, and you're going to hear much more about it from Dr. Gershov-West, who really was not and you'll hear why some of our panels are panel. She wasn't born in Israel. Her parents are here from down under, here celebrating the bar mitzvah of her brother's son, Mazel tov to both brother and sister-in-law, and clearly moved to Israel, trained in Israel, trained at Shaare, Zedek, and stuck with the institution, which she's going to talk all about, where she is today, and the kinds of wonderful work that she does, and important work, not just good work, but outstanding work that really is the forefront of emergency care in Israel, and particularly in Jerusalem. Without further ado, Dr. Gershov-West.
Thank you, Dr. Platt, for the introduction. Thank you all for coming. Thank you to I can't pronounce your surname, so thank you for everything I'm coming. First of all, just a couple of corrections, if I may. I don't run the emergency department. I'm one of the senior doctors there. It's run by Dr. Salon, who took over. He was the second in command after Dr. Applebaum, and when Dr. Applebaum was killed tragically. Dr. Salon took over, and I've been with him since Dr. Applebaum's time. A second correction, nobody knows me as Dr. Gershov-West. I stuck in the Gershov because my father's here. Otherwise, it's not even on my name. And in fact, nobody knows me as Dr. West. I've known by anybody who's ever worked in the emergency department as Debra. I'm one of the doctors. It's a title that's never sat well with me, so I'm just Debra. And the third thing I would like to just say before I start, as Dr. Platt said, I want to give you the inside story. The most exciting thing about working in Shaare setting, and I think the most dramatic thing is really the inside story, the day-to-day life. There's not a day that goes by without excitement. There's not a day that goes by without a story to come home to my children, and they wait for them. So in fact, when I prepared this, my children were choosing which stories I should tell. Tell this one, tell that one, because over the years they've heard them all. And that's what I wanted to do. And I'm glad, when I heard I had such a prestigious, impressive panel who'd been dissecting my stories, I tried to choose the ones that had raised certain issues that I'm opening up entirely to your discretion to discuss as you wish. Okay. On any given day, if we stand outside Shaare Zedek looking in through a wide-angled lens, you'll see a range of dilemmas being played out on the real life stage. Unfolding in an emergency department, you can have an elderly gentleman in severe respiratory distress. We have to make a decision about intubation. On one hand, he has a son who says, please, let him go. He's suffered, let him die in peace. On the other hand, another son, equally forceful, an ultra-Orthodox son, who begs us to do anything we can, anything in our power to save his life, because every moment of every life is holy. You pan the camera, lens a little further, you'll see a King David lookalike in the throes of an acutely psychotic Jerusalem syndrome. He's absolutely convinced that he's a reincarnation of the biblical Jewish figure. Focus the lens on the pediatric intensive care unit, and you'll see a 5-month-old Arab child lying there in an incubator, intubated, fighting for his life, draped in amulets to ward off the evil eye. These scenarios are a snapshot of the religious and cultural dilemmas that doctors face in Shaare Zedek on a daily basis. Dilemmas that span the life cycle from pre-birth to post-death. Tonight I want to relate to you, as I said, some real-life vignettes. These are some of the cases that I have personally encountered. I want to give you a taste of the day in the life of a Western doctor working in the Middle East, where religion, culture, and instead politics help to create the daily experience. Clearly similar dilemmas are faced by physicians all around the world. Yet in Israel, and I really think specifically in Shaare Zedek, and I can say this because I've worked in other hospitals in Israel as well, laden with overtones that reflect our multifaceted society and the emotions and the beliefs and the politics that flow through it. It was very hard to choose a case, and as I said, my children helped. As I thought of one story, another entirely different, equally relevant, equally dramatic experience would come to mind. Each and every case, each and every patient I met, and I meet until today, leaves an indelible impression on me and influences the way that I practice clinical medicine in Israel. After each 3 or so cases, I want to invite the members of the panel to offer their input and thoughts on, as I said, any issues that they choose, any issues that are raised to your discretion. At the end, what I would really like to do is open up the discussion to all of you, because I think, personally, I would love to hear your feedback. I'd love to hear your opinions on what I experience day to day. I'd like to hear the West looking in from the outside on the Middle East. Okay, I want to start with Jake, a young Orthodox couple of Ashkenazi descent, actually recently made Aliyah from Australia, were referred to the paediatric neurologist at Shaare Zedek. After their 8-month-old son, Jake, had become floppy. Basically, Jake had been a normal child, he'd been interacting with his environment, he'd developed, he was sitting, he was crawling, he was playing with toys, and just slowly, bit by bit, he was becoming floppy, flaccid. He started staring out into space, becoming less interactive. The parents were, needless to say, worried. They went to the local doctor. The local doctor referred them to a paediatric neurologist, Professor Shaare at Shaare Zedek. As soon as Professor Shaare saw Jake, she realised that something was seriously wrong. She recognised that he had signs of a neurodegenerative disease. She specifically thought of the tentative diagnosis of Tay-Sachs, and she gently broached the topic with the couple. Now in Australia, at the time, there were no known cases of Tay-Sachs. We don't have genetic screening, we don't in Australia. It's not routinely offered to couples. And the only thing that they knew about the disease was that it affected Ashkenazi Jews. So even though the diagnosis had not been made, they wanted more information. They asked Professor Shaare if they could put them in contact with a geneticist who could give them more information about the diagnosis. Professor Shaare, if anybody's ever met her, is extraordinary. She's very personable. She did much more than that. She made phone calls on the spot. She called in a social worker, a counsellor. She called in a physical therapist, a speech therapist, everybody to support the family. And she also called in the geneticist. The meeting with the geneticist was, needless to say, extraordinarily traumatic. They were told that should Jake indeed have Tay-Sachs, the disease was inevitably degenerative, always fatal. It was further explained to them that the disease was hereditary, with an autosomal recessive inheritance, which basically meant that 25% of their future children would be likely to be affected with the same disease. After a simple blood test, within 10 days they received the result. Jake was diagnosed with infantile Tay-Sachs. He'd been delivered a death sentence. Jake deteriorated rapidly. He became blind, mute and paralysed. He had recurrent seizures. He was repeatedly hospitalised in the paediatric department. He died at the age of 26 months. This tragic story has a happy ending. Immediately after Jake's death, the young couple chose to try to conceive again. They decided, this was obviously based on their religious beliefs, that they would take their chances. They were going to bear more children. If they bore another child with Tay-Sachs, they'd leave the child's fate to God's hands and pray for a miracle. The hospital offered them another option. They offered them an option that was fully acceptable in terms of Halacha, the option of PGD, which is pre-implantation genetic diagnosis. I'm sure in America you all know what that is. In Israel it was fairly revolutionary at the time. It was explained to them that this would involve intravenous fertilisation, where they take out the eggs and the sperm, and they test the embryo for Tay-Sachs prior to reimplantation, such that only healthy embryos would be reimplanted. The couple was concerned. They still weren't sure this was halakhically sound. They were put immediately into contact with the rabbi, the hospital's rabbi, who explained to them that it was perfectly halakhically sound. In fact, Shaare Zedek was one of the leaders who looked into the question of when is a life a life. The Schleswig Institute is associated with Shaare Zedek. And according to Judaism, a life is actually a life only 40 days post-conception. In Islam, incidentally, it's 60 days. In Christianity, it's from the moment of conception. This 40-day window gives Shaare Zedek an opportunity to do pre-implantation genetic diagnosis, to do stem cell research. The couple was convinced and they decided to go ahead with prenatal genetic testing. 16 months later, they gave birth to healthy twins, a boy and a girl, at Shaare Zedek. Shaare Zedek recently celebrated the 200th birth of a child from a family with genetic defects through this PGD program. 5-week-old baby when I first met him. He presented with a one-day history of a cough, he had a fever and he had shortness of breath. He was a child, the pregnancy, the birth and delivery being completely normal. He'd smiled his first smile the day earlier. When he came in, we thought we were dealing with a simple viral infection, a bronchiolitis. We treated him with oxygen, we treated him conservatively. He seemed to recover. He was discharged home within a couple of days. The next time I saw Mahmoud was 4 months later. He came in seriously ill. Again, he had a fever and shortness of breath, but this time it was apparent that something serious was going on. From clinical examination and from his x-ray, he looked like he had an opportunistic infection, which is the type of thing you see in patients who've got AIDS or immunodeficiency. It was really very dramatic. In fact, we immediately started testing for this type of thing. And what we found was he did indeed have an opportunistic infection. He didn't have AIDS. What he had was a very rare genetic disorder called severe combined immunodeficiency, where basically he had no functioning immune system whatsoever. He didn't have a single immune cell. He couldn't fight off any disease. It was obvious that the only way to save his life was to place him in isolation and to get him a bone marrow transplant. Now, Mahmoud was the second child to a young couple from East Jerusalem, from Halacha. The first child, Ra'anan, happened to be a good bone marrow donor, and we took several times from her bone marrows in order to transplant it to Mahmoud. The parents were lovely people, very simple, had no idea what was going on. In the end, what we did was we brought in the grandfather, who was a patriarch of the family, who usually works in the Arab communities, and he acted as the go-between for the duration of Mahmoud's care. I looked after Mahmoud for 5 months in the intensive care department. I know it sounds strange to you, but he had 2 bone marrow transplants in our intensive care department with 2 other patients. I have to give a caveat. This was before my period of Shaare. This was when I was in Halacha beforehand, many years ago when it was more primitive. But I had to bring in the story because it's so relevant. He received 2 bone marrow transplants. We had to resuscitate him twice during that period of 5 months. Every day we would take blood from wherever we could, any vein we could possibly find. We'd create a smear, and at night I would look under a microscope on the ward to see if he had any white blood cells, to see if the bone marrow had taken. During the time that I was in my residency in paediatrics at the time, I decided to transfer to internal medicine. And the reason that I kept staying, was that I couldn't leave Mahmoud. I wanted to see him recover. Every day, as I said, I would look at his blood. Every night when I was on call, which was twice or 3 times a week, 4 or 5 o'clock in the morning, I would go into the intensive care, I would drape up, try and get sterile, and I would pull him out of his incubator, and I would just hold him and pray for this tiny little child to recover. Despite the cultural and language barriers, I became very close with his family, both with his parents and his grandparents. The mother would walk around with a necklace. The necklace was in the shape of the map of Israel, but the map of Israel was completely covered with the Palestinian flag. This was before the time of Yitzhak Rabin's murder. So it was a bit strange at the time. We never discussed politics. The family repeatedly invited me to their home in Halacha, and I never dared to go. As I said, I was about to transfer to internal medicine and waiting for Mahmoud to recover. And I remember I was meant to start work on a Sunday. Friday night was my last call. I went into the lab, I looked under the microscope, and I found my first white blood cell. 9 days later, Mahmoud recovered and went home. 17 years later, Mahmoud is alive and well. I've never seen him since he was 10 months old, but I've kept up with him. He's one of the nurses at Shaare Zedek, who's part of his Kabbalah, part of his clan, and he's told me basically what's been happening to him. We're going back to Shaare Zedek, and the rest of the cases are from Shaare Zedek. Here I don't mean to tug at your emotional drawstrings, and anybody who was there on Tuesday night at the evening for Al-Hamado has heard part of the story. I don't believe that the experience of a physician working in Israel is complete without describing the experience, especially of an emergency medicine physician working in the time of a war, in the time of a terrorist attack. I deliberated over which pigua, which terrorist attack, unfortunately, from the many terrorist attacks, to relate to you. In the end, I chose the Merkaz Arab pigua, again, the one that I mentioned on Tuesday evening. It raised so many emotional conflicts for me that until this day I have not been able to resolve, and I wanted to share them with you. The story started in Adar. It was in Adar 2008, which is pretty similar to what's happening now. It's pretty similar to what's happening now. There were rockets amongst them the southern city of Sderot. City of Sderot was under siege. Its population were living in bomb shelters. A group of teenage boys were removed to the Yeshivat Merkaz Harav in Yerushalayim in order to give them some respite. On March the 6th, which was Rosh Chodesh Adar, it was a Thursday evening and I was on call in the emergency department. The emergency department was as hectic as usual. The place was packed, every room, every corridor bed was taken up. I was standing next to a Mada paramedic as he was actually looking for a bed to transfer his patient to, when he received a call on his pager. Shots were being fired at the Merkaz Harav Yeshiva, which is only minutes away from Shaare Zedek. There were already reports coming in of many dead and wounded. We sprung into action. We announced a mass casualty event over the loudspeaker in the hospital. We sent a message out to all the relevant emergency and trauma doctors. We started just moving all the patients out from the emergency department. Basically, we take them by their trolleys and we move them out anywhere, to the corridors, to the lobbies, up to the wards, anywhere we can. We empty out the emergency department within minutes. Everybody over the loudspeaker hears the call. Everybody comes out to the emergency department and takes over whichever patient they can. We hand over the files, we move them on. So within minutes, the emergency department was empty. We walked into the trauma room and we prepared the trauma room for the admission of simultaneously of mass casualty event. We called the operating theatre, we called the blood bank, we called the relevant specialists. We divided ourselves into teams to decide who would treat whichever patient walked in the door. Before we were even close to being ready, the wounded began to arrive. Amongst them, the most critically wounded boy in the whole Pigua. This was a 14-year-old boy. He was ashen-faced, he was bullet-ridden, he was literally bleeding to death. As we drew him in, moments before losing consciousness, I looked down at him and I said, the first question we say in trauma which is, what is your name? He looked up at me and he said, Ani Naftali Mesderot. I'm Naftali, and he was from Sderot. We intubated Naftali. We raced him to the OR. I don't want to give the gory details, but he was bleeding to death. We had a whole team of doctors and surgeons, and each of us had a fist or a hand in some other part of his body. I personally had my hand in his open abdomen, and I was pressing down on his liver, which was bleeding profusely. Two of my colleagues that night were Arab surgeons. They were people that I'd worked with for years, and I knew very well. We raced together, we worked as a team. There's no doubt that there was a palpable tension that night that I'd never felt it before. I kept wondering, as we were racing along, what were they thinking? What were they experiencing? We avoid political debates in the hospital. I had no idea where they stood politically. Were they enraged like us? Were they ashamed to be part of it? Did they see themselves as part of it? Were they indifferent? Were they pleased? Would their families be joining in the celebration on the streets later that night or earlier the next day and handing out candies? To this day, and after many other similar incidents, I don't know the answer to that question. Once Naftali was in the OR, in the operating room, my personal involvement in his care was over. I returned to the ER and I began to help dealing with the other scores of patients, most of them teenagers, some with gunshot wounds, many of them nifgei helen, which is victims of shock. By that time, the place was teeming with doctors, with social workers, with psychologists, with the hospital rabbis, helping the victims, their families and friends. I left that night at 2 o'clock in the morning. Now, whenever I leave that night, my mother, who lives in Australia, speaks to me on the phone. She's afraid I'm going to fall asleep on my drive from Moderator, and I won't. So every week, I have a long conversation with my mother at night. That night I couldn't. I just had too much in my mind. I wanted to be updated. I wanted to try and absorb what had happened. I tuned into the radio, and I heard the constant update about the terrorist attack. I heard that 8 boys had been killed, 11 at that time had been wounded, 5 were still in a critical condition. The journalists were discussing previous terrorist attacks that had also happened in yeshivot with high school teenage students. As I drove up to my house and I was about to turn off the radio, which was difficult, and get out of the car, I heard a familiar voice. I heard the voice of a Dr. Picard, who's a paediatrician in our hospital. Now, Dr. Picard, 6 years earlier, had lost his own son, a 14-year-old boy, in a terrorist attack in the yeshiva in Otniel. His son had been hiding under his bed when a terrorist broke into the hospital, into the yeshiva. The terrorist had looked under his bed and shot him and killed him. Dr. Picard got on the phone, onto the radio, and he was speaking. And the radio announcer asked him, and I remember his words, every word till now. He asked him, how does a parent ever recover from a trauma? And Dr. Picard said, you never recover, ever. You learn to work, you begin to smile. Every now and then you even laugh. But you remain a neche. You remain an invalid. You carry your disability with you every moment, every day, your whole life. Naftali survived his wounds. After several weeks in hospital, after months of physical rehabilitation, after years of psychological care, he's now an 18-year-old boy. He recently finished school and is about to embark on a lifetime of contribution. He's actually not eligible to go into the army because of the wounds that he's encountered in the past, but he's deciding which course of contribution he wants to take. So at this point, I want to stop and hand it over to the panel for their
It's almost impossible to follow words of that presentation. And I think the warmth, the dedication, the commitment, and the true feeling of helping others shows in Dr. West, Debra, presentation. I think it's pretty clear that understanding what one sees in an emergency room in Israel is quite different than most places around the world. And I encourage everyone to seriously think about joining Steve on that mission in July, because it'll be an opportunity to really see firsthand what's there. It's not anything to say, I've seen one emergency room, I've seen them all. I think it'll be an experience of a lifetime that I'd encourage whoever can go, and I'm sure he can double that number. If he gets 30, he'll go with 30 as well. Let me introduce the panelists, make some comments on why they are here. First is Dr. Baron, is a neurosurgeon, trained in Philadelphia Temple, residency at Jefferson and at Cedars Fellowship in neurosurgery. He is a strong supporter, advocate of Israel, of Shaare and healthcare in general. We'll make some comments. Dr. Dael Geft is finishing his training in cardiology at Cedars. Will be going on to a transplant cardiology fellowship. Dael is sort of the reverse of Debra. Dael actually did medical school in Israel and came back to the U.S. to train, and he's here as a second generation interest in Shaare. His father actually used to work in Shaare as a cardiologist. Then we have Dr. Jonathan Hulkower. Jonathan is a psychiatrist who actually has made I wouldn't say an unusual, very typical today, transition of a half aliyah. What do I mean by half? Maybe 3/4. He spends most of his time in Israel with his family, who are in Israel, and he actually continues to see patients here in the United States. He will be encouraged, I'm sure, to devote full time in Israel over the course of time. So what we have is those that appreciate from within and without, those that are purely U.S. trained and working, those that are trained in the U.S. now in Israel, and those that are sort of semi-trained and partially trained in Israel, to help comment on the particular cases and the nature of medicine in Israel and how it is different there than here. So if perhaps I ask Dr. Baron first to make any comments he'd like to make, and then we'll ask each of the panelists to make any of their comments, then we'll have a dialogue with Debra as well on the types of cases that she sees.
Well, that was a spectacular delivery on the vignettes, but the first one where you spoke about the verbalization really strikes a chord as far as, I said the first case that she spoke about really strikes a chord as far as the interplay between religious Judaism and clinical medicine, but more importantly, almost the interplay between the Haredi, or the ultra-Orthodox community, and clinical medicine. Obviously, or I should say, the process of Halacha and medicine has certainly gone through a lot in the last 20 years. I happen to have about 15, 20 textbooks on this, some of them dated to the 1960s versus today. And if you read these responsa, and if you read, for example, the discussions of, say, transplantation in the 1960s and 70s versus what's written today, they're almost night and day different, because certain things are being permitted where in the past it wouldn't. And I see one of the tremendous difficulties, especially given the communities in B'nai Brak that rely on very, very insular
sources, I can definitely see how this can certainly be a problem. And I'm sure your ethics committee is dealing with this on a regular, if not daily basis. The second case where you spoke about the Arab child definitely is a very, very interesting thing. I operate daily, or almost daily, at Cedars-Sinai, and it's very, very interesting to see the interactions between the different communities, and especially in Cedars-Sinai, we have, I don't know, we have more Persians than I guess maybe Shaare, Zedek, but we also have a lot of Muslims. We also have a lot of Muslim doctors, and there are certain political sensitivities that are crossed and things that are said. Even like I'll be operating and I'll have an anesthesiologist make a comment to me here and there, and sometimes it definitely brings thoughts up. The third case, even though, yes, that you spoke about the Muslim or the Arab doctors, I think what's more important, at least as a surgeon that I take, is the whole triage thing. I trained in North Philadelphia, which essentially is a war zone. I mean, I've dealt with codes in the emergency room where 10 or 12 people were shot. And it becomes a very, very, emergency mode in medicine is a very complicated thing. And many of you, I'm sure, have watched ER and Grey's Anatomy and all that, but they don't cover what goes through your mind in mass casualties. And there is nothing, as a clinician, sometimes the pain that we actually experience, I mean, I remember taking someone up to, a police officer in Philadelphia up to the operating room to take out a subdural hematoma, and there were two other guys with clots in their brain with 4 operating rooms running, and there's decision making, literally, where sometimes you would think, oh my gosh, I'm at this big university hospital, my problem can be solved, but the reality is sometimes it taxes the society, and it taxes supply, and the cost and the real world losses are the computations that go